Hi guys, welcome back to another episode of Vital Femme MD. I'm your host, Dr. Jessica Poland. I'm a maternal fetal medicine physician. I specialize not only in high-risk pregnancy care, but also in postpartum restoration. In this episode, we're going to talk a little bit about the 6-week postpartum sex myth. So one of the biggest myths in the postpartum recovery is the idea that once you hit 6 weeks postpartum, you absolutely are 100% ready to have sex again. For many women, that is just not a reality. Picture this. You go to your 6-week postpartum check. Doc says, okay, everything looks good. You go home. Your husband is looking at you like an orangutan in the wild. And he says, so babe, how did it go? I'm here to tell you that being medically cleared for intercourse is not the same thing as being physically comfortable, emotionally ready, hormonally balanced, or even interested in having sex. Today we'll discuss the following things. Number one, what the 6-week clearance by your doc actually means. Number two, why sex can feel different after baby, why low libido is incredibly common, and realistic ways to reconnect with your partner and your body postpartum. So first and foremost, why sex feels different after the baby. So postpartum intimacy can feel different for a number of reasons. The first is hormones. Especially if you are breastfeeding, estrogen levels are often super low postpartum. Low estrogen levels can lead to vaginal dryness, irritation, low libido, and honestly, just significant discomfort with penetration. Number two, physical healing. You may still be recovering from things like tearing, scar tissue, pelvic floor injury, C-section, and remember, for those of us that have had C-sections, recovery is not just the incision site, but it's also muscle tension and pelvic pain. Number three is the mental and emotional load that we're carrying postpartum. A lot of women are just really touched out postpartum, in particular if you have other children at home. You're exhausted, you're overstimulated, sleep deprived, and trying to adjust to a completely new routine and a new baby. Libido and desire is very hard to access when your body and your brain are in survival mode. So honestly, number one, just cut yourself some slack. The biggest reframe, the biggest thing that I want you guys to understand is this. Intimacy does not have to just mean penetration. Resuming intimacy does not mean that you have to jump immediately to penetrative sex. There are other things you can do to reconnect with your partner and slowly build up in a way that feels comfortable for you. Remember, you can start with kissing, cuddling, massage, external touch, mutual pleasure, even just lying next to each other without any pressure. And honestly, focusing on connection and pleasure instead of, quote, trying to have sex again, often helps desire to return much more naturally. You do not have to go from 0 to 100 overnight. Take your time, build up slowly, do not pressure yourself. These are some tips for making postpartum intimacy more comfortable. When you are ready to reconnect physically, these are the biggest things that I think can help. And this is both personal and professional advice. I've been postpartum 4 times. Number one, wait until that beautiful baby is actually asleep. Nothing kills libido faster than hearing your baby cry. Ladies, please do not try to have sex during a 15-minute contact nap. Feeling relaxed and not constantly on alert actually matters way more than most people realize when it comes to comfort and sexual desire. Number two, use a lubricant every time. Sometimes I have patients say, Dr. P, I think I'm fine. You're probably not. Especially if you're breastfeeding, remember again that estrogen level has dropped postpartum, so your natural lubrication is probably suboptimal. For that reason, vaginal dryness and irritation are really common. So even if you think that you're adequately lubricated, use a lubricant, trust me. My personal recommendation is a silicone-based lubricant because it lasts longer. It tends to work really well postpartum. Astroglide is a great brand. It can be a little bit messy. Yes, just take a shower after. Next step, focus on pleasure and connection, not just the penetration. We did talk about this earlier, but your goal does not have to be vaginal intercourse right away. Touching, kissing, massage, external stimulation, emotional connection, all of that truly matters. Removing the pressure to immediately return to penetrative sex can actually help you build back desire in a much more comfortable and natural way. Number 4, help yourself feel like you again. So when we're postpartum, we don't always feel super comfortable in our bodies. Even if your body does not feel completely like your own yet and you don't feel like you're in the exact shape that you want, you can still do things to help you reconnect with yourself. Please do not wait until you've lost all of your baby weight or feel like you're in the best shape of your life to get your sex life back on track. You can do things like take a shower, do skincare, put makeup on if that makes you feel good, wear perfume, buy lingerie that fits your body now, not your future body. Go onto Amazon, buy something inexpensive, have fun with it. Say, I'm going to invest $20 and I can throw it away when it no longer fits me. Play music, dim the lights, eat your favorite food, pour a glass of wine. You do not have to earn feeling sexy by reaching some future version of yourself. Next tip, sex toys can really help. For some women, external vibrators and other toys can help gently reintroduce pleasure and take pressure off of solely penetrative sex. Honestly, this can also take the pressure off of feeling like you have to orgasm, chiefly from penetration, immediately. Starting with external penetration and coupling that with internal penetration is completely okay. The goal here is comfort, pleasure, connection, and rebuilding confidence with intimacy, not just forcing your body to perform a certain way postpartum. Next tip, eat and hydrate like someone whose body is healing. Your libido is connected to your overall health. It's not a separate thing. If you're severely sleep deprived, dehydrated, undernourished, and just in survival mode, your body is going to have a hard time focusing on desire. You're just going to be focused on surviving. Make sure that you're controlling what you can control. One of those big things is what we're eating. Focus on protein, healthy fats, hydration, omega-3s, iron-rich foods, in particular if you are anemic postpartum. When I say healthy fats, I mean fats that naturally occur in both plants and animals, not ultra-processed foods. The Mediterranean diet is one of the healthiest diets in the world. You guys have heard me talk about this on the show before. People living in blue zones, which are areas in which people consistently live past the age of 100, almost universally they follow some variation of the Mediterranean style diet. If you're not already on it, get on it. I'm also going to link my favorite libido boosting food list below for you guys. It's a free download that I've curated. I also want to discuss with you when pain is not normal. One really important thing, painful sex postpartum is common, but that does not mean you should just suffer through it. And it's certainly not something that should be persistent. If you're having severe pain, bleeding every time, fear or anxiety around intercourse, persistent pain for months postpartum, please go get evaluated. Don't let your doctor or any health practitioner tell you, oh, you're postpartum and you had a C-section or you had a bad tear. Of course you're going to be uncomfortable. No, go get seen. And if somebody's not listening to you, you need to consider finding somebody who will. Pelvic floor physical therapy can actually be life-changing. Sometimes vaginal estrogen, which is topical, helps. Sometimes scar tissue or muscle tension needs treatment, and sometimes you can do those things at home with coaching. You deserve support. So, in closing, there is no gold medal for having sex exactly 6 weeks postpartum. Healing is individual, readiness is individual. Rebuilding intimacy after baby is allowed to happen gradually. Your postpartum recovery is not a deadline, it's a process. If you guys found this video helpful, please make sure to like, subscribe, and share this with another mom who probably needs to hear this. Don't forget to download my free libido boosting food guide link below. See you in the next video.